Hello, I'm Dr. Carmen Morales, a specialist in reproductive genetics, and I want to talk today about PGT or preimplantation genetic testing. This is a genetic test that is performed during an IVF cycle and allow us to select only the non-affected embryos for transfer. There are three different types of PGT depending on the type of genetic abnormality it tests. We have PGT-A or PGT for Aneuploidus that is testing the number of chromosomes present in the embryo. We know that embryos with a normal number of chromosomes, what we call aneuploid embryo, are having a reduced implantation rate, a high miscarriage rate, and can give babies affected of chromosomal syndrome, like for example Down syndrome that is caused by trisomy of chromosome 21. We also know that there are couples or patients at higher risk of producing these embryos with abnormal number of chromosomes. This is the case, for example, of advanced maternal patients or women over 37 years old, in the case of couples with recurrent miscarriages, or in cases of severe male factor. So by analyzing the embryos and transferring only the euploid ones, the normal ones, we are increasing the chances of a healthy ongoing pregnancy rate. The second type of PGT is PGT-M or PGT for monogenic disorders. This test is specific for couples that they know there is a genetic monogenic disorder in the family. It can be because one of the members of the couple is affected of a genetic disorder, for example, in case of Huntington disease or neurofibromatosis, or because both members of the couple are healthy carriers of a mutation in the same gene. It's what we call recessive disorders. And an example of that is beta thalassemia or cystic fibrosis. And the third type of PGT is what we call PGT-SR, and it's for structural rearrangement, and it's for couples that are carriers of a structural rearrangement. An example of that is reciprocal translocation. In a reciprocal translocation, two chromosomes interchange a piece of DNA. Carriers of these translocations are usually completely healthy, but they are at high risk of producing embryos what we call unbalanced, with abnormal quantity of DNA. They have missing or extra pieces of DNA, and these embryos usually end in a miscarriages or can give babies with severe affectation. So by testing the embryos, we can choose for transfer the ones with the correct amount of DNA. So at ReproClinic, we focus the medical treatment with an integrative holistic approach. We are concerned that there are many factors that can influence the quality of the eggs, as for example stress levels, unhealthy habits, hormone imbalance, etc. And there is no magic formula for everyone. It's for the reason that we treat every patient as special and offer them the best approach based on their needs, not only for the medical point of view, but also helping to balance and prepare the body and the mind. You can contact us for more information and we will be happy to help. Thank you.